So, hi everyone, a very good morning to all of you. I am Dr. Sumer. I have with me Dr. Deepthi in the daily morning 10 a.m. transform session.
Yes, a very good morning to all the dear students.
And today we are going to talk about something which is very important and very unique. Every time we are doing a transform live on the YouTube, there would be students odd who will come into the chat and say, "Sir, my internship is very busy. Is it possible? Sir, how should I manage my internship and NEET PG preparation together? Is it possible or not? If yes, how to do it?" So, your take, Dr. Deepthi, do you think internship and NEET PG preparation is possible?
Absolutely, yes. In fact, I very often say that internship is a blessing in disguise, right? Why? Let's understand this. Your main problem or concern, I would say it's not a problem, is that we have limited time. Yes, am I right? When we are in internship, we have limited time that we can give to our, exam preparation. And the beauty is that once we understand that we have this limited time, we will understand that we need to follow a program which is very well planned, right? There is time for revision along with test practice, right? There is sufficient amount of testing that we are doing, as well as ensuring that our content is strong enough, something that can be read multiple times, something that has a high hit rate, right? Which means the first thing we need to understand in internship is you are not doing an MD in 19 subjects, right? You're not doing a postgrad in 19 subjects. You have to clear an entrance exam, which is based on your MBBS preparation, right? Which means we do not have to know everything about everything. We have to know everything about something that is asked in the exam. And what is that something is what the entire preparation has to be based on, right? So I say it is a blessing in disguise because actually, you will not, once you understand the value of it, the essence of it, you will not keep running after things. You will realize कि ये चीज है जो most important है, इसका hit rate अच्छा है, यहाँ पे 360 degree support है. This is what I have to do, and if I stick to it with consistency, I'm surely going to do well, right?
And
So yes,
also, I think all also we need to know, very important thing that usually, you would say that sir, my internship is busy, and by the time we reach the NEET PG, we see the rank one or two. Usually, you will find them with busy internship. So that question, that is it possible, should be answered once and for all. It is definitely possible,
yes.
and you need to tell yourself this: even if I'm doing a job or internship, you can manage it all. You can manage it all. I have seen students with very busy internships get rank one. I've seen students doing jobs making a comeback. All you need to do is, number one thing is mindset. You tell your mind I can do it, because if you say you can't, it will not happen. Number two is you manage your time well. How do you manage your time well is by prioritizing the high yield. At that time, if you have less time, you don't follow every random advice. Sometimes you will see on a YouTube somebody would come live and say, "अरे आप ये पढ़ो, गायटन करो, गेनोंग करो, ये करो, वो करो," and you're like, मुझे ये सब करना है, and आपके पास internship में time है नहीं. You will spoil it all. You don't need to be perfect. People who are less than perfect are winning the game. You need to find a more working model, more like doable model.
So what we are going to do is we are going to talk about the preparatory phase during your internship, but we are going to divide it into two sections. There are students with us who have cleared their FMGE exam and are now pursuing internship as per the government orders. So it may be stretched longer than 1 year, right? We all know the problems that our FMG students face. The rules are not same for them, right? So their internship may be slightly longer. At some places, maybe 1.5 years. At some places, maybe they're even asked to do a 2 year of internship, right? So we will talk about what a FMG pass out student who is doing their internship, what they need to do for their NEET PG preparation. And then we will be talking about IMGs, right? So our own graduates from India itself, right? What they need to pursue during their internship to ensure that we are doing smart study. We're not just logging, right?
So first rule of internship is you need to make every day count. Now sometimes in internship what will happen is you might be having a busy posting and it is very tempting to say कि यार इस posting में बिल्कुल भी नहीं पड़ता, अगली में कर लूंगा. Now what happens is you're reducing those 2 months from the total calculation and it becomes very tough to come back. How to do it in busy internship is that even if it is a busy posting, you do something, at least the short subjects. Maybe maybe you give 1 hour a day, maybe half hour, maybe walking around with some study in between, but you make some progress every day. Now, what will happen is if I make some progress every day, in my busy postings, I'll be covering something. And in my less busy posting, maybe you have a community medicine posting, you might be able to kill the bigger subjects. If I was in your place, I would also use an artificial schedule over the top of all of it. Because when the going gets tough, inner motivation gets dried up. If it is a very busy internship, अंदर से लगता है नहीं हो पाएगा, you need a force from outside. And probably I feel the DAMS TND course on the app would be the ideal course for internship because there's a schedule coming up. And you tell yourself कि अरे अगर मैं नहीं भी पढ़ पा रहा एटलीस्ट टीएनडी तो फॉलो करूंगा एटलीस्ट टीएनडी के शेड्यूल में कुछ तो पढ़ के जाऊंगा एंड यू हैव अ an external pressure over you to follow that schedule even when the going is tough. So that is my first message is make every day count even if you have a busy internship. Don't wait for good days. They may not come or they may be very less. Then you will not be able to finish that course there. Second thing is,
And
I'll ask Dr. Deepti to add on after that is, I think she's already mentioned this, so I'm just repeating it. Don't try to do MD in every subject. The biggest challenge that we feel now with the students is that you have information. Definitely you have information, but you have too much of that. That is not required in the exam. There are many resources who are, trying to make students MDs, and we always try to do the exact opposite. We always try to tell the teachers, boss, we are trying to make them MBBS. So the syllabus has to be catered to. Otherwise, medicine is infinite. You can just learn radiology in 1 year. It's up to you, but you will have 10 questions out of it. What about the rest of 190 questions? Be practical about it.
absolutely, yes. So I think let's start with the strategy now, and then we will reinforce what Dr. Sumer has said. Yes, consistency is the key. So now let's start with the strategy. So first, I will be talking about students who have cleared their, MBBS from India, so and are pursuing internship, and then we will be talking about students who have passed their FMGE exam and are pursuing
I
internship.
have a,
Now, the
Dr.
first
Deepti,
thing that I want,
Dr. Deepti, before you say, I have a very big observation about my FMG बच्चा, मुझे बताना बहुत जरूरी है. कई बच्चे ना FMG के मेरे पास आते हैं कहते सर मैं पास हो गया हूँ एक बार इंटर्नशिप मिलेगी ना तो पढ़ना शुरू करूंगा. बिल्कुल गलत अप्रोच है. इंटर्नशिप मिलने में कई बार बहुत समय लग जाता है तब तक तो पूरा का पूरा नीट पीजी का फेस टू फेस का साइकिल अटेंड कर लेता उसके बाद इंटर्नशिप में जाकर रिवीजन करता तो शायद इस डिले को अपनी अपॉर्चुनिटी में बदल लेता. आई एम अगेन सेइंग ऑल द एफएमजी स्टूडेंट्स वेटिंग फॉर इंटर्नशिप वेटिंग कैसे मतलब ऐसे खाली बैठ के करें कि पढ़ते पढ़ते कर लें. यूज दैट टाइम वेरी इंपॉर्टेंट बेटा.
right, so let's start with the preparation for NEET PG in internship. Now, as Dr. Sumer said, consistency is the key. Even if it is for only a couple of hours, but making every day count is important. Now, how will that happen? That will only happen if you have certain targets to meet, right? हमें अगर पता होगा यार, this is to be done in this period of time, then yes, I will make every day count. लेकिन अगर हमारे पास कोई टारगेट नहीं होगा, if I have to go randomly, then I will say, okay, let it be not today, I'm very tired today, आज कम time है, right? So we will have reasons not to make everyday count. So first important thing is to have targets in internship, very essential. And the best way for internship, I would say, is a test and discussion program. Now let me tell you why. A TND program is something where you have weekly targets. And as Dr. Sumer said, अपने आप से motivation आना बड़ा मुश्किल होता है, especially when it's hard postings. So at the end of the week, if you have a target, you're going to meet a faculty, right, live on the app. They are not just going to teach you, they are going to motivate you. They are going to push you towards little efforts which will make big differences in the end. So the first advantage of doing the TND is it comes with well-defined targets. There are whole schedules available, and not just this, you have two cycles in 1 year, right? So it's a 6 month thing. So अगर आप अपनी internship की वजह से suppose you miss one subject का test, don't worry too much. You can cover up that subject in the next cycle as well, right? So the beauty is you have the targets, but you still have some leverage. You have some time to make up in case it is a busy month for you, right? The second advantage of TND is the entire week is to yourself. So it comes with a stick. The stick is you have a target at the end of the week, but you're not getting, hammered every day. आपके पास पूरा week है to prepare that particular topic. And in the TND, you automatically have access to back to basics, which are the wonder video lectures, very concise, crisp, yet super high yielding. Right? So in the 1 week, you can prepare with those video lectures by doing a self study with whatever time you have. Right? The entire set of recorded lectures is there. So you take your week, you finish your target as much as possible. In this week, we would also want you to cover the questions from DQB, whatever topics, subtopics you are covering, please cover them up from DQB, right? Please cover the PYQs of that subject in that week. These are the two basic essentials we want you to cover with your notes or B2B in the week before the test, right? The Q bank and the PYQs which are already available in the Q bank. At the end of the week, you attend the discussion. Yes, you make your short notes, and believe me, the notes in TND are super amazing. They're like icing on the cake. You have your notes, but now the notes that we will give you in the TND are like only in the form of algorithms, key points, differentiation features in form of tables, image discussions, everything. It also gives you updates. So everything is there. You take those notes in plain paper. Even if you don't want to, it comes with annotated notes. And then you can use those TND notes even for your revision close to the end. So bit by bit, जब आप TND का schedule follow करते रहते हो, you're automatically covering major chunk. And as I said, it comes in two cycles. So दो NEET PG के cycle होंगे TND में, एक NEET का भी cycle होगा. So that you're covering for both exams. राइट और अगर आप एक साइकिल में सारे सब्जेक्ट नहीं भी कर पाए 6 मंथ्स के बाद दोबारा से पूरा रोटेशन शुरू हो जाएगा एंड यू विल गेट अनदर सेट ऑफ टेस्ट पेपर्स एंड डिस्कशंस सो दैट्स द ब्यूटी it gives you the free time that you need but also gives you certain targets to meet. Okay, Dr. Sumit, do you want to add something to that?
I see a lot of queries regarding, sir, I want to join the TND, but when it is going to start? And that is the most important information that you need to have today about DAMS live courses. DAMS live courses are like in DAMS totally 5 plans are there. There is a test series, there is a deadly combo, there is back to basics which has all recorded videos. Above B2B you have TND. TND has 3 cycles of live TND now in the Alpha edition. Every 6 to 7 months one cycle of NEET PG TND will be completed. So in a 12-month subscription, you will get 2 NEET PG TNDs live. And plus, whenever you join day one, you will see the previous cycle recorded also. So you will have actually 3 cycles, one recorded, 2 live of NEET PG TND, and one live cycle of any set TND is also now included in a single TND. Now in the Alpha edition, we have condensed your TNDs into a single TND with 3 live cycles. So you can join anytime. It's a rotational course. In the next 12 months, you will get everything thrice. So you will have one cycle of NEET PG TND, paper will change. In the next cycle of TND, another set of question paper will be there. You will get one cycle of any set TND with a separate paper as well. So you will have a lot of material with you, lot of discussions, lot of doubt solving. We believe this TND, because it also includes recorded lectures of back to basics. So because you are an intern, you have that self-learning freedom as well as TND targets to meet and discussions to do, and that keeps you on track. So that is what a lot of people were asking. So I just wanted you to know it's a rotational course anytime you join. And also what we have done is We have also done a video yesterday on all the plans and what are the changes in the plans. So there are many other features also which we'll talk about subsequently. But what are the changes in the DAMS plans that has been done as YouTube video yesterday on the DAMS YouTube channel? It is a good idea to attend that video to get the hang of the channel. Also, I would say one line and hand over to Dr. Deepti here is steal time from internship. अपने आप कोई नहीं देगा, अपने आप कोई नहीं देगा। अगर तुम ये सोचोगे ना कि एक दिन ऐसा होगा कि वहां बैठा हुआ मेरा सीनियर मुझे बोलेगा अभी एक काम कर 2 घंटे पढ़ ले फिर थोड़ा काम करने के लिए आ जा, ऐसा बहुत कम चांस है। नया बिल्कुल नील तो नहीं है, बहुत कम है, छीनना पड़ेगा। स्टील टाइम
I
फ्रॉम
will tell you
इंटर्नशिप।
how to do that as well, along with your TNT. Don't worry, we'll talk about that. But first, let's try and draw a parallel now for our FMG students. So far, we have talked about internship for our Indian medical graduates who are doing their internship and what would be the best thing for them. Now, coming to the FMG graduates. Now, when we talk about FMG graduates, how is your internship different? Is that it is stretched over a longer period of time, right? I know many of you had to do even a 2 year of internship as a mandatory thing. Some of you are doing 1 year. I don't know why do they not have common laws for everyone, but yes, the internship is slightly stretched. And also, I would say that there is a little more, or you have to bridge a little more gap in your preparation, right? Now, when we talk about FMG exams, although the new pattern of exams is very much like NEET PG, मगर हो तो अगर आप डैम्स के साथ पढ़ रहे हो, you are already in your FMG also, you are studying with us based on new pattern. लेकिन बहुत सारे हो सकता है FMG मेडिकल ग्रेजुएट्स कहीं और से पढ़े हों एंड देन वी आर नॉट श्योर कि क्या हमारा कंटेंट अप टू द मार्क है इवन फॉर नीट पीजी एग्जाम्स और नॉट। नीट पीजी एग्जाम में कॉन्सेप्ट बहुत इंपॉर्टेंट है, एप्लीकेशन ऑफ कॉन्सेप्ट बहुत इंपॉर्टेंट है। तो मेरे लिए मैं आई वुड से फॉर आवर एफएमजी स्टूडेंट्स I would say the best program for you in your internship is App Live course. Now, there is a reason I say that. Number one, your internship is way longer. Okay? Number two, the gap that we have to bridge is also bigger, right? So, App Live में क्या होता है ना? Every day we have a live class at 5 p.m., which means consistency, right? So अगर आप internship कर रहे हो, majority of you on most of the days would be free by 4, but I know that there would be some days where there will be longer postings as well, right? So 5 p.m. पे we have these live classes which are 5-hour classes every day, 5 to 10 p.m. Now they ensure consistency. दूसरा, App Live is our prime product, right? Where teachers are teaching you live every day, but at the same time, you're also getting the entire set of recorded videos, right? For example, आप हमारे साथ App Live में let's say आप हमारे साथ अभी मेडिसिन पढ़ रहे हो, but let's say कि आपकी सर्जरी पोस्टिंग चल रही है and you want to read a case that you have seen today, then you have entire set of back to basic videos with you and you can use those videos at that time कि चलो यार आज मैंने सर्जरी में हर्निया देखा था, so why not just study hernia ka topic from back to basics, right? They come with handwritten notes, they come with notes underneath the video, they come with workbooks जो आप print out ले सकते हो, right? So that's the beauty कि you will be consistent every single day, you will be learning concepts. हमेशा हमने back to basics नाम क्यों दिया या हम App Live में क्या कर रहे हैं? We actually build you from the base. As it says, वी वॉन्ट टू इंश्योर कि जो भी आपने एमबीबीएस के करिकुलम में पढ़ा है वो सिर्फ मगअप ना किया हो, वी आर एबल टू अंडरस्टैंड, वी आर एबल टू अप्लाई, वी आर एबल टू इंटीग्रेट। बहुत सारे एमसीक्यूज इन एफएमजी एग्जाम, इन नीट पीजी एग्जाम आर इंटीग्रेटेड बेसिक साइंसेज विद क्लिनिकल साइंसेज, राइट? सो आई वुड सजेस्ट दैट फॉर एफएमजी पास आउट जो जिनको आगे जाके नीट पीजी देना है, द बेस्ट प्रोग्राम विल बी ऐप लाइव. It will automatically come with back to basic videos. It will also now in the new alpha version come with a live fast track TND cycle. So one cycle of TND will be specially conducted for our app live students. So app rotation pay, you can also test your application skills with the teachers based on a predefined schedule. सो ऐप लाइव में सब कुछ मिलेगा, डेली बूस्ट मिलेगा, कंसिस्टेंसी मिलेगा, शॉर्ट बर्स्ट्स में आपको कॉन्सेप्ट्स मिलेंगे, टीचर्स का मोटिवेशन मिलेगा, हर दिन अ टीचर इज कमिंग एंड टीचिंग यू, राइट? सो आई थिंक दैट इज व्हाट इज एसेंशियल। सब्जेक्ट स्पेशलिस्ट जब अपना सब्जेक्ट पढ़ाते हैं, they exactly know how things are asked, they know कितनी डेप्थ में जाना है इस सब्जेक्ट में, या इस पर्टिकुलर टॉपिक में हम कितना सुपरफिशियल पढ़ाएंगे तो भी वो सफिशिएंट होगा। सो इट्स अ राइट मिक्स ऑफ राइट डेप्थ and width of a particular subject that you need for your exams, right? So this is a parallel I want to draw. NEET PG के लिए for our Indian medical graduates, I would say TND is an excellent program for your internship. And for our FMGE students, I would say App Live course is what is a must do for you.
And also, I'll add a principle of learning everywhere in your life. Like whenever you're doing internship, it's also an opportunity to see things happening around you. Because
Yes.
at the end of the day, you want to become a doctor. The exams will test your, skill as a doctor as well. So be observant. Instead of looking at internship as a problem, you look at it as a opportunity to see things, and seeing will build your memory more. Whenever you see somebody putting a catheter or a IV line or a fluid or antibiotics, please look at them, how they are doing it, how they are reconstituting the drug. Are they making it in saline? Are they putting some fluid? Which kind of fluid is given when? And so and so forth. You will
And it
start
all depends on
loving
how much you
you
want to
start
use.
loving your dance lectures more when you see practical things also happening. You're like, अरे यार ये तो बताया था सर ने, ये तो ऐसे ही हो रहा है, and it will be
And I want to
exciting.
add something,
I
Sumer.
see the X-rays also. See the X-rays also there.
Yes, not just clinical subjects. I'll tell you the beauty of it. हम क्या करते थे, when हमारे लेडी हार्डिंग में बहुत एक काम होता था, रिपोर्ट कलेक्शन, राइट? सो दे यूज्ड टू सेंड अस टू अ स्पेशल पैथोलॉजी ब्लॉक की इसकी ये वाली रिपोर्ट लेकर आओ। तो when you are interested in what you are doing, you use that as well. For example, let's say आप एक पेशेंट की एंडोमेट्रियल बायोप्सी रिपोर्ट कलेक्ट करने गए हो, why not just have a व्यू ऑफ उस रिपोर्ट में क्या लिखा है, क्या वर्ड्स यूज किए गए, प्रोलिफरेटिव चेंजेस हैं, सिक्रीटरी चेंजेस हैं। जाओ और अपने पोस्ट ग्रेजुएट को पूछो कि मैम ये कौन से दिन पे टेस्ट लिया था आपने, इसका रिपोर्ट सिक्रीटरी आया है, इसका इंटरप्रिटेशन क्या है, or if you have read it from your notes, see it happen in real life, right? So we've told you कि अगर biopsy का report secretory आएगा, it means the cycle is ovulatory. So it's not just कि आप clinical सिर्फ medicine, surgery और gynae में सीखोगे या peds में सीखोगे. Every little thing you do, आप blood bank गए तो आज पैच से let's start reading something about blood transfusion या transfusion reaction, है ना? सो आप कोरिलेट कर सकते हो, आप अपनी पढ़ाई को इंटरेस्टिंग बना सकते हो। सो व्हाट आई वुड से इज द रूल ऑफ थंब इज दिस इज व्हाट आई हैव फॉलोड इन माय लाइफ। सब कुछ करेंगे, मगर जहां पे जिस वक्त हो वहां पे सिर्फ वही करेंगे। ऐसा नहीं होना चाहिए कि इंटर्नशिप में हम कट के कोई वीडियो लेक्चर देख रहे हैं तो वहां भी मिस कर दिया और वीडियो लेक्चर का भी फायदा नहीं उठाया। तो अगर आप इंटर्नशिप में हो, कहीं बैठे हो, उस वक्त इट्स अ गुड आइडिया कि यार रैपिडली चल कुछ जो चीज देखी उसके एमसीक्यू सॉल्व कर ले, कुछ इमेजेस देख ले, राइट? ऐसा भी नहीं होना चाहिए कि जब हम इंटर्नशिप में हो और पढ़ाई करने का टाइम हो उस वक्त हम सोच रहे हो यार आज वो नहीं देखा, आज ये नहीं किया। सो wherever you are, be 100% there and try and correlate. Even during your postings, you can solve a mini test, right? एक वार्ड से आप रिपोर्ट कलेक्शन करने के लिए जा रहे हो, चल यार डेली क्विज ही कर लेते हैं, it's just 5 MCQs. Yes, so that is what Dr. Sumer meant when he said you have to steal the time. Yes.
And also, I wanted to add a line about our FMG bachas. We are starting a new face-to-face FMG course in July. I think on 8th we are finishing this particular batch in DFX, and it is starting. So on the day one of the new batch, definitely we will come and do a
Yeah,
live
always
orientation
do.
for how
Yes.
to go about the December FMG exam. It will be there are two options available for FMG exam. You can do it face to face in the DAMS Gautam Nagar, and the same class is relayed live, and you can join it anywhere in the world on the app live in the FMG live course in the app itself. We'll also do a separate video on YouTube also regarding the FMG plans on the app, so that you are clear on what is included in your course. It would be happening very soon. And also, a lot of people have asked, sir, MCQ कैसे करेंगे? So I think we need to know, we have to, play around. जैसे in the morning you can do a 5 question quiz on the app, which is called as the DAMS Daily Quiz. Then there is a case of the day below it. You can just do a case, which will be a clinical vignette for you. So 6 questions are done like that. Then in between, when you're running around, there are multiple mini tests in the DAMS test series. DAMS test series is the only test series which has mini test also. 20 questions.
Yes.
You just do 20 questions like from one point to another. You can do that.
एक
Near
चीज
the
मुझे यहाँ
exam,
पे
you
ऐड
can
करना है
increase the
डॉक्टर सुमित.
frequency. Near the exam, you can increase the frequency of your grand
See,
test.
what is the beauty of a mini test? अगर आप एक बड़ा टेस्ट शुरू कर रहे हो तो वो आपको कंप्लीशन की फीलिंग ही नहीं देता. आप इंटर्नशिप में हो, यू ओनली हैड लेट्स से 15 मिनट्स 20 मिनट्स. नाउ यू कैन डू अ बिगर टेस्ट हियर, राइट? सो आपको ऐसा कुछ लगता ही नहीं कि आपने कुछ खत्म भी किया. बट इफ यू हैव अ मिनी टेस्ट अवेलेबल, इट्स जस्ट 20 MCQs. You would hardly take 10 minutes to do that. एंड सडनली यू ऑल्सो हैव अ गुड फीलिंग अबाउट योर सेल्फ. यार मैंने एक टेस्ट खत्म कर दिया. वो एक पर्टिकुलर टेस्ट था, IBQ था, क्लिनिकल विनियट का टेस्ट था, पैच का टेस्ट था, माइक्रो का टेस्ट था. इट गिव्स यू अ फीलिंग ऑफ कंप्लीशन एंड सेटिस्फैक्शन. सो मिनी टारगेट्स आर व्हाट कीप यू ऑन द ट्रैक एंड इवेंचुअली यू रीच द बिगर टारगेट्स एज वेल. तो उससे हमारे डेली MCQ प्रैक्टिस का जो नंबर है, जो हम बोलते हैं इट शुड स्टार्ट विद एटलीस्ट 50. Close to the exam, we'll make it 100. It's very easy to do it with the Alpha app. So you have mini test, बहुत तरह तरह के mini test हैं, है ना, जो हम utilize कर सकते हैं.
Okay, एक बच्चे ने बोला कि sir, the difference between DAMS and other coachings is DAMS is emotions. Absolutely correct, but also it is important that there are a lot of other, so-called coachings which are not coachings. They are recorded lectures, set of recorded lectures, which cannot be called as coachings. What is my vision of a test prep company, or what is my idea is, so me and Dr. Deepthi, we have appointed ourselves as the principal of your school. And every day in the morning assembly on the app itself. So this video that you are seeing, some of you are seeing on YouTube, some of you are seeing on the DAMS app. So even if you remove all your social media, you join the school. So every day in the morning we'll talk to you about some topic. The topic will be written on the top. If it is a worthy topic for your situation, we will take your queries and answer. And so every day that is happening. Plus, there are a lot of courses which are live plans, like TND is a live course. The app live is a live course. So somebody has to teach to call themselves as a coaching academy, is what my sense is. Also, I have a few questions that I want to take very fast. One is, you cannot change. Somebody has written in the chat box. It is a very beautiful message. You cannot change the past. You cannot change the world. You cannot change what people think, but you can change your attitude, your assumptions, your belief, and change will happen inward, and that inward change will push you into where you want to reach. I'll
Yes,
ask Dr.
very
Deepthi to give
beautifully
any
said.
last minute advice for FMG students in the final 25 days.
Yes. So for all our FMG bachas, what is that I want you to do in these 25 days? Number one is DFX. That comes at the top of my list. Zarur karna hai. Try and do 3 readings of DFX. DFX has everything. Okay, DAMS FMG Express is the parallel version of DVT. DVT is what we do for NEET PG. DFX is what we do for FMG students. It has everything. It has one-liners, it has images, it has keywords, it has clinical vignettes, it has tables. सब कुछ जो आपको last 25 days में सब subjects में revise करना है. So my very very special advice to my FMG students is, please don't leave subjects. अगर आपको अभी भी लगता है कि कोई ऐसा सब्जेक्ट है जो आपने अच्छे से नहीं किया है, मैं बोलूंगी उसका कम से कम DFX अच्छे से करके जाओ. Right? So DFX 3 readings try करेंगे. Rapid multiple readings are always better than slow readings close to the exam. दूसरी चीज, अगर आपने अभी तक नहीं किया FMG PYQ का बाप, right? So we recently conducted the live sessions, NEET PG and FMG PYQ का बाप. We have kept them together because your board is same and इधर के question उधर आ रहे हैं and vice versa. So FMG PYQ ka BAP is included in your plans, right? NEET PG FMG 3.0. Please do that. The third thing I will advise is your PYQs. So यहाँ पे हमने last 3 years के PYQs cover किए हैं. इसके अलावा डैम्स की एक स्पेशल FMG की PYQ की बुक आती है, right? Which is super high yielding. So for now, practice of questions, you can use that FMG book that DAMS has launched under our own publication. It is error free, it is excellent, it gives you a lot of PYQ coverage. ठीक है, वो भी कर सकते हैं. And the last thing that I will say is FMG CBTs and mock, right? So दो FMG के CBT आ रहे हैं. Please, all बच्चास have to do those CBT papers. उसके video discussions. And in your test series, बच्चे, you have FMG mock test papers. खूब सारे टेस्ट प्रैक्टिस करो, खूब सारी गलती करो और अपने गलती को DFX से या नोट से रिव्यू करो. This is what I want you to do in last 25 days. It is more than enough is what I will promise. Okay?
Okay, I think we have, some queries like Tanisha is saying, sir, I'm a fourth year student. I'm not able to finish any single big subject. I am only done with peds, anesthesia, dermat. I am big subjects are left. Tanisha, this is happening because you're, probably doing it in the recorded format. And in the recorded format, you become the controller of your situation, and the water tends to flow towards from the high altitude to the low. It takes the easier path. पानी हमेशा ना आसान रास्ता लेता है. तो अगर अपने ऊपर छोड़ोगे ना तो छोटे छोटे सब्जेक्ट करके खुश होते रहोगे. ज्यादा कर लिए थोड़ा सा. In the fourth year, I would strongly recommend use the app live course where every day a live class is happening, and try attending the live classes as per schedule rather than से मेडिसिन आ रही है और आपने सोचा कि नहीं मैं तो डर्मा करूंगी और आपने डर्मा पे 2 महीने लगा दिए जबकि उसमें क्वेश्चन 8 आने थे, मेडिसिन पे 25 आने थे. सो यू नीड टू पुट दैट पर्सपेक्टिव इन माइंड. Fourth year now, instead of getting scared, I think you've picked up the right mistake at the right time. And Tanisha, आपको इस समय पे मेडिसिन सर्जरी ऑब्सगाइनी करना ही पड़ेगा. ऑब्सगाइनी से शुरू कर लो. फोर्थ ईयर में आ चुके हो, मत छोड़ो मत छोड़ो. एग्जाम में भी आएंगे, प्रॉफ में भी आएंगे, नीट पीजी में भी आएंगे. इनको छोड़ नहीं सकते.
तनीषा, yes sir is absolutely right. Start with big subjects बेटा और कोशिश करो कि हम बैक टू बेसिक्स जो है वो बहुत बहुत डुएबल है. उनकी ब्यूटी ये है वीडियोस की कि वो डुएबल हैं. आप उनको मल्टीपल टाइम्स कर सकते हो. They'll give you a big confidence boost for your professional exams, and at the same time this is what you would need for your NEET PG as well, है ना. So might as well do it. इसमें सिर्फ एक ही गेन है, लॉस कुछ भी नहीं है. ठीक है.
So to conclude today's session, today's session was primarily for internship, both for Indian medical graduates who are doing internship right now and foreign medical graduates doing internship or waiting for internship. Number one is, please use this opportunity. Don't think I cannot do with internship. एक बार सोच लिया नहीं हो पाएगा तो फिर तो फंस गए. Mindset. Number two is learn everywhere. हर जगह सीखने की कोशिश करनी है. Number three, make every day count. Even if it's a busy day, you need to be consistent. You need to have the discipline to take something out of that day. कुछ तो हर दिन करेंगे so that by the end of the day, I have covered lot of ground. And also, I would suggest, cut out the distractions. Use back to basics. It is more doable, more crisp. And many people say कि सर आप बहुत सारे लोगों ने तो ये चीज 250 घंटे में दी है, आपने कम आवर में दे दी, ये क्या बात हुई. सो बेटा मुझे आपकी जिंदगी का टाइम भी पता है ना, आपके पास कितना टाइम है. उस हिसाब से मैंने बनाया कोर्स. जितना आप कर पाओगे पूरा खत्म कर पाओगे. सिर्फ नेटफ्लिक्स की तरह, नेटफ्लिक्स में बहुत सारी पिक्चर हैं लेकिन आप सारी नहीं देख पाओगे. सिर्फ स्क्रॉल करने में बहुत टाइम लग जाता है. सो वी ट्राइड अवर बेस्ट इन ऑल अवर कोर्सेज टू मेक इट मोर डुएबल सो दैट एनीबडी इज डूइंग इट कर लेगा. मेरा आपसे सिर्फ एक ही रिक्वेस्ट है, स्टार्ट डूइंग इट नाउ. करना शुरू करते हैं. कब से शुरू करें? आज से करते हैं. आज से करें. आज से प्रॉमिस करो. मुझे सब अच्छे चैट में कमेंट में थम्स अप करके प्रॉमिस बोल के बताएंगे. आई प्रॉमिस दैट आई स्टार्ट टुडे. दिस फर्स्ट बैरियर ऑफ स्टार्टिंग हैज टू बी ब्रोकन. कभी कभी क्या होता है ना, अपन उसी में अटके रहते हैं. मैंने शुरू ही नहीं किया, करूं कि ना करूं. जैसे एक बच्चा कभी मुझे पूछता है, सर क्या मैं डीवीटी कर लूं? हाँ कर ले. 2 दिन बाद टेलीग्राम पे उसी का मैसेज आया. तो उसको नहीं पता कि मुझे पता है कि तेरा मैंने इंस्टा में भी देखा हुआ है, रिप्लाई किया है, तूने नाम सेम ही है. कर ले भाई, डीवीटी जरूरी है. 30 टीचर ने बनाया, 7 दिन में कवर हो जाता है, हर बार आता है. सर करूं क्या? फिर करूं. करना है, अभी, आज शुरू करो, टुडे इज द की. More
And
keep thinking, more you keep asking, you're wasting time.
all right, so today before we close the session, definitely we have to give you target of the day. So what is the target? Everybody knows. आज क्या target है? आज हम सबका GT day है. पिछले Sunday we have given mock 9. Everyone has given mock 9 on the test series section. And we are alternating one mock with one GT. So आज सब बच्चे एक GT देंगे. अगर अभी तक आपने GT 51 नहीं दिया है तो GT 51 दोगे. अगर 51 दे चुके हो तो गो बैक 50 देखो. अगर वो पेंडिंग है तो वो दो. If 49 is pending तो वो दो. If 48 is pending तो वो दो. Right? So whichever is your pending GT in the last 4 GTs, you will finish your pendency. Right? And then we will compare the number of correct questions. Remember to use the MCQ skills me and Dr. Sameer have taught you in the 2 special transform series. One was the transform on silly mistakes and the other was the transform session on how to make an educated guess. Please use your skills. बहुत सारे बच्चों का मुझे मैसेज आया था आफ्टर मॉक 9 कि मैम ये टेक्निक्स यूज करके नंबर ऑफ करेक्ट क्वेश्चन डेफिनेटली इंक्रीज हो गए हैं. So let's do that. Let's work on content. Let's work on MCQ skill together. Right? So everybody will give a GT and then in my Telegram channel, you will share the number of correct questions and along with that, you will tell me कि पिछले mock 9 में कितने थे number of correct और इस वाले में कितने हैं number of correct. Okay?
And also I see many students who come and say sir कई बार पता नहीं लगता कि आप लोग live आ गए हो YouTube के ऊपर, so it's a good idea to subscribe to this channel and click on the switch on notification bell icon so that you don't miss out on any video from here. And also I would strongly recommend you can follow the DAMS official because there are many channels using the DAMS name just because many piracy channels are also there. So just see DAMS Daily Official. That is the official Telegram channel to follow. And mostly any video that we do, we share the link on the official channel so that you are there. Any test that is happening, any case that is uploaded, the notification is always pushed on the channel as well by the team so that you don't miss out on anything. Please follow us on the DAMS official Telegram channel. The link is there in the comments also, and please share the link with your friends and juniors as well.
And lastly, I will definitely answer query of Mohammed Ali. किसी को भी अगर ऐसा लग रहा है कि इस time पे they want to go through my notes, the secret weapon, yes, the secret weapon is OG last push. The book is based on LRR. उसमें मैंने बस images भी साथ integrate कर दी हैं, right? So OG last push, hardly 140 pages. Yes, it will build your score in OG, and it is nothing new. Core concepts, core content, it will be like a rapid revision for entire obs and gynae. So किसी को भी करना है, you can take the OG last push. The book is available on our DAMS Alpha app in the MediMart section as well as on Amazon. So it's just 140 pages and it's pure bliss. Yes, I think I've put my heart into this book. And in the next session, let's see how we can make it even better. But yes, OG last push is really the last push that you need for obs and gynae close to your exams. Okay, so all the best everyone. Have a wonderful day. Please do give the GT today and let me know your number of correct questions.
And please start. Stop asking. Starting is the first barrier to break. उसके बाद आसान लगता है. किसी भी प्रॉब्लम के बारे में सोचते हैं वो बड़ी लगती है, जब शुरू करते हैं तो लगता है उतनी मुश्किल नहीं था जितना हमने सोच रखा था. शुरू करना ज्यादा इंपॉर्टेंट है. लेट अस स्टार्ट टुडे. अगर लगता है 1 महीने में कर सकते हैं, शुरू करते हैं. इसी महीने में बात हो सकती है, लेकिन शुरू तो कर. लेट्स स्टार्ट टुडे बेटा. ऑन दैट नोट, हैव अ ग्रेट प्रोडक्टिव डे अहेड. बेस्ट ऑफ लक.
Take care everyone. Have a great day ahead.